The Western Cape continues to be the epicenter of the coronavirus in South Africa, with the highest number of infections and deaths. We're taking a glimpse here on Morning Live at each of the respective provinces. We've gone through a couple of them. It's now the turn of the Western Cape. And to give us an update on the situation in the province, we're happy to be joined by the Health MEC, Dr. Nomafrench Mbombo. Good to have you. Thanks so much for being with us here on Morning Live.
Good morning, Leanna. Good morning to all the listeners in South Africa. Thank you for having me. Ellie?
MEC, let's talk to the numbers. Obviously, we saw some of the figures being released last night. Just please correct me if I'm wrong on any of the figures, but what I've got so far, the confirmed infections, this obviously is minus the recoveries, are sitting at 15,829 in the Western Cape. And we've got the death rate just in the Western Cape alone, 357 deaths recorded. Are those the latest figures that you have at your disposal as well?
From the national statement released last night, yes, it's true.
Okay.
But you must understand that because the national has to report deaths before we report them, there might be some that are there, but we'll only be able to share them today in the afternoon. Okay. But that is the correct statistics as of last night.
As of last night, those are the correct statistics, which is very worrying because, you know, when you look at the figures in the Western Cape, I think there's major concern that the Western Cape obviously is the epicenter, but the situation seems to be getting worse and worse daily. Give us your views on what you believe is happening.
If you recall, Eliana, that when the National Health Minister, together with his team, shared the South African magnitude of the virus, they did indicate that South Africa wouldn't be able actually to be exempted to have a virus epidemic, just we've seen even in the so-called first world countries with best health systems, with a better economy, which we have seen in the UK, the US, and also parts of Asia, and also in Europe. That's what we have seen. And therefore, when they indicated the level 5 lockdown, it was about just to delay the curve so that the health could be able to be prepared when this happens. In terms of their modeling, they projected, still actually are projecting that the worst scenario in the whole of South Africa will be around August, September. The Western Cape projection, it was around about June, where we anticipated around about 80,000 at the time, noting that these figures, this mathematical modeling keep on changing each and every time that the experts, they've got something new coming up, taking note that it's a new virus in South Africa and therefore it will mirror and impact differently compared to other countries. Therefore, it becomes difficult to transplant the whole of the information that side. So from our side, at the time, we did anticipate about 5,000 to 7,000 deaths around about June. Sadly, it came early, which is it was still in May now. It's coming early. So the worst is still coming according to the modeling. Still coming in South Africa, it also still coming in the Western Cape. So being the first one where the epidemic, we have seen a high positivity rate, it also makes it actually to be a lab or where the country could be able to learn some of the interventions that we are trying to implement, so that at the time that it reaches other provinces, as we have seen now in the Eastern Cape is coming up, they could be able to see what lessons to be learned and also what other interventions that could be implemented. Yeah. Secondly, Leanna, you will recall that in the modeling or in the strategy that Professor Karim presented at that time during that lockdown, we were going to stage 4 as according to their strategic framework. And the stage 5 was going to be the hotspots. And in Cape, it started another way around. Whilst in other provinces, you'll find that they were still looking in terms of the community transmission. And then stage 5 was going to be around the hotspots. For the Western Cape, already we were on the hotspot. We are on the hotspots, which were as a result of the clusters that started in the lockdown level 5 through the essential service workers. We've seen in the factories, the South African police services. We've seen also in the correctional services, also clusters, just we saw also later on the old age homes, and the clusters as health workers, and noting that these people reside outside their workplace, meaning when they go home, especially with the labor, with the workforce, the homes, it's in those areas where there's a high density of the people, the overcrowding, that's what now resulted into these hotspots.
Yeah.
So Western Cape epidemic is an advanced stage. Western Cape epidemic, it started earlier than in other provinces.
Yeah, and this is it's a great concern, no doubt, for people living in the Western Cape. And from next week, we're obviously going to be seeing the whole country, and I want to focus on this a little bit more, moving to level 3 of the lockdown. However, there was a statement made yesterday by our health minister that hotspots may remain on level 4. And of course, within the Western Cape, these are major hotspots, which actually may find that you don't change, whether we're talking to Cape Town, the West Coast, Overberg, the Cape Winelands municipalities. These are considered hotspots. Is this a concern for you? I mean, or would you welcome the fact that these are not opened up completely and still remain on lockdown to try and contain the spread of the virus?
That part is confusing in a sense that the president announced that the whole country is on level 3, and that in the areas of hotspots that will be have already been identified. Actually, from us, because we're the first ones to identify the hotspots, and we submitted to at a national level and also presented as the National Command Council in terms of the interventions that we have to implement there. The issue is about how do we do things differently, or how to expedite, and also how to robustly in terms of the interventions in those hotspots. Noting that all metros in the whole country, they've been identified as such, and in our case also some of the rural districts, the Cape Winelands. Already, we are advanced in terms of the plan, implementing the whole of government, because it's crucial that it mustn't only be the health response. Because if the area is got high density level, of course, they will be bound, we'll have more of the local transmission in that area. The same applies if now the issue of the economic cluster in that area, if there's a business that doesn't implement the requirements related to the occupational health and safety. What is the response from our economic department to see to it that that department, that business, and also even the employees, they have to meet the requirements and the business to implement the regulations. So we're already at that advanced stage. Same applies, it's true, in terms of the restrictions of the movement. In those areas, we have divided into smaller chunks, clusters. Let's make an example, Khayelitsha, where we divide Khayelitsha into 6 sections. In those 6 sections, we make it a point that from Section A, you make it a point that you restrict the movement and see to it that whether we do this community-specific screening testing, and also when you have to make it a point that you isolate and quarantine other people, when the law enforcement officers together with the South African police and the Metro Police, we restrict that movement. And same applies with the taxi industries. How do you make it a point that also in that particular area, there is a limited movement? So already we are a step ahead in terms of the implementation. We have identified them earlier, and we zoom already in those kind of the areas. But let's make an example for the metro, where it has got 6 sub-districts. Each and every sub-district, we've identified areas that have got a high local transmission. And all our departments in the province, and also for the city of the Cape Town, we're already busy with the implementation. And we're engaging with the community, because you'll need the whole of society, not only the government. We have to engage the faith-based organizations, the community leaders, in order to be able to assist, especially in the information related to the 5 golden rules, the social distancing, the hand hygiene, surface hygiene, the wearing of the mask, and all of those needs to be implemented as well.
Yeah. We've been hearing reports coming through that hospitals in the Western Cape are really buckling under the pressure with regard to the amount of patients that are coming through, that ICU beds are filling up, if not filled up. Are these reports true? Is it that dramatic inside the hospitals of the Western Cape?
In terms of the planning, we have already, as I indicated earlier, in terms of the model and the projections of how many cases we're anticipating and how many deaths. Our health response has already been advanced in terms of looking at all types of the beds. We already know that currently the province has got 1,500 plus of the acute bed hospitals, which is our existing beds. So we look in terms of that, we might need extra about 650 plus beds, which we could be able, which we have done it already, where when you discharge some of the people and also where you limit some of the elective surgery. So that part is not full. We still could be able to accommodate as many. And then the issue of the critical bed, that includes ICU beds. All over the world, public services will always have fewer critical beds than private. Private has got more beds. So when you look in terms of our critical beds, about 150 in the Western Cape, we're making up about extra 100 from our own, but also we have to purchase more beds from the private, which is already the discussions are advanced in terms of the 300 beds that we have to purchase from the private. Taking note, it takes quite longer to get ICU trained, not only the doctors, the nurses, we need the technical team and all of that. That's why the fastest way is for the private, which the signing of the documents have already been completed. In addition, you'll need intermediate beds, which we call field hospital beds. The CTICC, that already now is providing us with about 868 beds. And additional to that, we have got a warehouse that will accommodate about 350 beds. We have got outside metro, an old hospital that now will give us also more beds, almost 200. And also in addition, we are looking in terms of the phase 2 part of the field hospital where we could use the City ICC 2. There are 2 City ICC. And if need be, also you can use the stadium. Let me just explain what's the difference between these beds. The intermediate care bed in the field hospital is the one where a person will need a bed, might need an oxygen, but specifically for their COVID or respiratory problems. And then whereas in the acute hospital beds, that's where the whole package that needs to be delivered, especially when the clinicians are managing the case comprehensively. But you mustn't forget that 90% of the patients, as you have seen the recoveries, they do recover and they are being treated outside the hospital environment in the primary health care service. That's why we have to strengthen our clinics as well, especially when the people are coming up with the symptoms. Hence, we have got these triage and testing sites.
How many people have you got in
the 18, we've got more now.
How many people do you have in hospital? How many people do you have in hospital currently?
Recoveries.
No, not recoveries. In hospital currently. I've got a figure of 665. Is that still accurate? That are in hospital?
It could be, because the last time I checked, it was 450 something. It could be. I don't have the correct figures. It could be. As you're noting that these are 650 something of the COVID, and I indicated already that our acute hospital bed numbers now that have been planned is about 2,000. If you add the 1,500 plus 650 something, gives you that kind of a number. So we're not necessarily overloaded. But the issue, Leanna, must indicate that is the health workers. Because you might have the adequate numbers in the current status quo, but you still have to add more because some of them get infected and then they have to be away for the 14 days. So we are also going to announce in terms of how many we need. We already know that figure, and also thanks to the National Health through the National Treasury, where they'll be able to assist us in terms of funding, especially the City ICC and the warehouse and others that we intend now to have.
So the report saying that the Western Cape may run out of ICU beds when it comes to the peak of all of this, you feel that you've got enough plans in place to cater for the eventuality of a lot more cases coming your way?
Yes. Now, the current beds already, we are keep on running out, noting that now it's winter season. So you'll have also other medical conditions, especially from the vulnerable group, that are not necessarily COVID. They may warrant for the people to go to the high care. So, of course, the 150 is not enough for the COVID. Hence, we've got the additional one where the projections that we might need about 554, which is, as I indicated earlier, that the arrangements with the private health to provide us more is already in advance.
MEC, there's been a couple of sort of, accusations towards the Western Cape as to the treatment of the lockdown. And, we've known that the DA's stance is that you were always against having this very hard lockdown, perhaps get rather a herd immunity going within people. These are the kind of messages that have always been put forward by the DA. Do you think that this has, in a way, resulted in perhaps a lighter treatment of the situation within the Western Cape and within residents and hence the spike in cases? Could this be behind why we're seeing the Western Cape at such a big gap between the rest of the country?
In terms of us being in government, in terms of the 33,000 staff members that are in the Department of Health, for us, we have never used politics in terms of what we do. In terms of the implementation, these are the dedicated people, clinicians, and also non-clinical staff that they've been rendering their services irrespective of the political environment. Because we don't want a situation where we think that politics will have quite a major effect on a doctor or a nurse somewhere in Garden Route or somewhere in the West Coast. But also noting that for health specifically, most of these outbreaks and infections, the epidemic, happen at the time of when we have lockdown level 5, where through the essential service workers that I've indicated, where we find that people who still visited stores and they got infected whilst they're in the supermarket. The factories that were opened, they were bringing essential services, just I made an example. So these were all in lockdown level 5. One thing I know for sure that we know from the health perspective is about whether you are in lockdown level 5 or even 0, the issue of the non-pharmaceutical interventions, that is the wearing of the cloth mask, the hand hygiene, the social distancing, the surface hygiene, and all of those will still remain, and it's going to be with us in the next year or two. So therefore, we find that whilst economic perspective they might have, there are discussions related to the economy, but for us, for health, we'll still have to render services irrespective of. And for example, now the schools will be open. It potentially will create also another cluster, but we have to advise each and every sector before it opens or when it's opening, and we have to respond as such.
Yeah, indeed. And I know that there is also a problem with some schools showing infections of teachers already in the Western Cape. But we don't have time to talk about that. I want to end off this interview with a post that you put onto social media. I know that you talk to leaving politics out of everything, but one wonders if this was the right platform for you to voice your opinions with regard to, this is the post, it says, so the Eastern Cape doesn't want us, the Western Cape economic and education opportunity seekers to be buried there. Now it means if your bundle of joy contracts COVID while here in UCT or UWC and dies in the Western Cape, you can't bury your child if you're in the Eastern Cape. Would you say Facebook was the right platform to voice these opinions?
It depends what I was responding to. It was a response to an interview that was conducted by the Eastern Cape Premier to one of the stations. So it was actually at the time that he was speaking to the public about that issue. So it was a response to that, because it was the one who was actually talking about this issue.
All right. So you felt that responding on Facebook was the right thing to do?
He was saying publicly. He was saying publicly that he was
Okay.
Because there was not being interviewed. So he was on the public space at the national television talking about that.
All right. Well, Nomafrench Mbombo, we thank you for your time. The MEC of the Health in the Western Cape, talking to us about the COVID-19 infection rate in the province. And we unfortunately have to bring the program to an end here. I know there's lots more that can be asked, but we can't, unfortunately. Sakina, the Western Cape, a big worry, but, many talking to that could be the scene coming to the rest of the country, and they're just ahead of the curve. But we need to wait and see, unfortunately, on that.
Unfortunately, that's where we have to leave it, Leanne. All right, we'll pick it up again